hardworking, amazing people about the healthcare for Ohioans. Yeah, you can take my spot. Pat snuck in, so I want to mention Pat Wahoviak is here. She is a city council person from East Cleveland. Thank you so much.
And I'm going to have a second microphone. We have a second microphone.
No, we just have the one mic. Can we do the second mic?
I believe so. The DJ told me so, like earlier. Yep, here it is.
Feedback thing.
We do have a
Come on, I don't really need.
We do have a second mic. Yeah, we don't.
We don't need a microphone.
You gentlemen need one?
I don't think our speakers need much of an introduction, but I will mention that Mike Goodell has introduced the Healthcare for All Ohioans bill
11 times.
11
20
times.
over 22 years.
That would be 22 years every legislature. Let's try that again. Mike Goodell, guys. Okay. And then superhero Tristen Rader, who's taken on the mantle. My colleague, Juan Corrado. So, the first question I have for both of you is, how the heck is this bill that's been introduced now 21 times in Columbus going to help Ohio?
12 times.
12 times?
Over.
I can't do math, that's why I'm a lawyer.
Yeah, because a session is 2 years.
You know the difference between God and a lawyer? God doesn't think she's a lawyer. Okay. All right, folks. Okay, you have those nifty little lights.
That's for the live stream.
That's for the online people. So sorry.
Very good, yes, because we do have an online audience tonight. And thanks again to all you folks out there. All right, so I'm going to shut up and I'll got your phone.
You do. Thank you. Let's get some of my notes. I appreciate it.
Oh, you have your notes there.
Just in case. Yeah. Always prepared. Boy Scout.
So the question is, how is the healthcare bill for all Ohioans going to help us?
Good evening, how are you? Hey, Bob, are you back there? Can you hear me okay, Bob? Good. It's great being here, and I really appreciate everybody who extended the invitation to both Tristen and I. Now, Cathe gave earlier introductions to a bunch of folks. I think one person was missed, Mike Rogolowski, who's running for council in Ward 7. Just wanted to mention Mike out there. Mike's out there all the time with CCCP and other organizations out in the community, and I just want to make sure he was recognized. But let me tell you about healthcare and how I got involved with it and how it's going to help. So when I was growing up, my grandfather, my mother's father, was a UAW union steward. He worked over at the Brook Park plant when it first opened up. And in those days, Walter Reuther was head of national UAW. And for years, Walter Reuther advocated that this country adopt universal health care, single-payer universal health care for decades. And actually, it started with FDR also, who was an advocate of single-payer universal health care. It has been going on. Now, my grandfather, when I was little, he's the one that instilled the politics in me, and the progressive politics. Said, we need, he always talked about the need for universal health care. I was fine. My father was a steel worker, and we got health care through Republic LTV Steel. But my grandfather said that you're one of the rare cases. There's a lot of people out there that do not have health care. Their lives are shortened. They struggle in life because they don't have adequate health care. And it's something that we really need. That went on because my father, who worked at LTV Republic Steel for 37 years, passed away just days before his retirement in '92. But then in 2002, if you recall, a federal bankruptcy court issued the order that took away the pensions and health care for the 72,000 retirees here in the state of Ohio, Ohio and the employers. And you know what I remember is folks on the other side of the aisle always talked about personal responsibility when it came to healthcare. I said, what about the person that made the contract with the company that they would work and dedicate their life to that company, and but they should get healthcare and retirement after they were done. And then at the last moment, the executives walked away with big salaries, big bonuses, and the corporation was able to file bankruptcy and discharge their responsibility to tens of thousands of workers and retirees. Where's the personal responsibility there? And in so many areas where people are unable to work or find it hard to work enough or make enough money to afford the health care. So I got elected to Lakewood City Council, and at that time, there was some discussion about national health care, Medicare for all. Dennis Kucinich was already a U.S. congressman working with Representative John Conyers out of Detroit and working on the Medicare for all. And I remember April Stotz coming to me when I was on city council, and she said, "Hey, Mike, what do you think about universal single-payer health care here in the United States?" I said, "I support it." And with the help of April, and she put together a group of Lakewood residents, we introduced a resolution urging our General Assembly and the Congress to support the single-payer universal health care throughout this nation. I went on from there and understand that single-payer health care had been introduced long before I got to the General Assembly back in 2002, and it was being introduced by a representative out of the Youngstown area, Representative Bob Hagan, who, when I started in the legislature, ended up in Youngstown, and Bob had introduced the bill. But there was like one or two sessions right before I started that there was no bill pending. And when I started, I sat down with Bob and folks with what is now Span, Ohio. It really wasn't existing at that time. But Jerry Gordon and others, and Kurt was around at that time. But we got together, meeting with Bob Hagan, and we decided to draft a new bill and start a new grassroots effort in support of single-payer universal health care, a state-based program here. And we got the bill drafted. We had a lot of people review that bill. We introduced it in 2003, the first year of that legislative session. And we introduced it, legislative sessions in Ohio is 2 years long. So every session we introduced that bill. I was there for 22 years. We introduced it for 11 sessions. Yes. And I'm so happy and I'm so proud that my good friend Tristen Rader, who won that seat, has also reintroduced the single-payer universal health care bill. Again, what number is that, Tristen?
289.
289, House Bill 289. So look that up. And is there a Senate companion?
I don't think so, not yet.
Not yet, but I think there's one coming. Or it is.
It was Casey Weinstein.
What's the number? Senate Bill 78. So look up both of those bills. Now, what we do know is one, so when talking to Republicans, how do you convince them to support this? And believe it or not, there was a couple of times during the 22 years I was in the legislature, we were able to get some additional hearings in the legislation. And it's because there are some Republicans that do support the concept that it's actually an economic driver, universal health care. So the benefit that Canada unions have is the corporations there don't have to bear the burden. Right. The auto industry doesn't have to bear the burden of providing health care to its employees because there's national health care in Canada. And that places Canada and their businesses at a competitive advantage over the U.S. because we have to factor in the cost of health care provided by the unions, by the companies, negotiated by unions into the price of items. And it's not spread across the entire society. When you spread it across the entire society, that's when you can actually drive down costs and make it easier for everybody. So Walmart, that doesn't provide health care for its average employees, has taxpayers providing that through Medicaid, but the auto companies, the union auto companies here in the United States provide health care. They actually have to provide a greater cost because of the insurance system, the way it's set up, because there's so many people that are not covered at all, and we pay that cost. So it will help society overall. It helps businesses. It helps maintain a healthier workforce there. It helps families, and no more bankruptcies. We know that still today, despite the fact of the Affordable Health Care Act, aka Obamacare, medical bankruptcies are still extremely high in this country, and that's something that should be unheard of in a country of so much vast wealth. I have family in Romania and Germany, and in both countries, Romania is a lot poorer than the United States is. They provide universal health care. And my cousins in Germany, I asked her, I said, Tinny, Americans say that the taxes are so high in Germany because you provide health care, there's some pension available, and you provide higher education. Are your taxes that high? Do you feel it's that high? She's saying we pay a lot of money, but look, I go to the doctor, I get no bill. I go to the hospital, I get no bill. I go to the pharmacy, all I have to pay is $10 at the most for some medication. But otherwise, she gets no bill. Her husband died suddenly, and she had a mental health crisis in her life. And in Germany, they have these kind of spas for mental health breakdowns like this. And she went there for 3 months. Her employer actually paid her salary during that time frame, but her entire stay there was paid by the healthcare system. And she came out of that a better person, and it benefited her family. And those types of things are so important. So it is something that will help society. With that, I'm going to end it at this point and turn it over to my good colleague, Tristen Rader.
And if you don't mind,
Thank you, Mike.
thank you. And if you don't mind, just introduce yourself too and tell us a little bit of what got you into healthcare too.
Oh, sure. Thank you. Tristen Rader, how y'all doing? Thanks for spending some time with us today. Thank you for having me. Been in the state legislature now for 7 full months. But before that was on Lakewood City Council, and there we introduced a couple resolutions supporting Medicare for all. But even before that, actually, Mike Skindle, then Senator Skindle, then running for mayor of Lakewood, Skindle, was involved in something called the Save Lakewood Hospital movement. And we were trying to save our community-based hospital, which had been managed by the Cleveland Clinic for the last couple of decades. And they pretty much managed it out of existence in order to move it to Avon where they could make more money. It's a profit-driven model. They're a nonprofit, but they're certainly out to make money for their companies, the insurance industry, everyone else that actually pulls the strings behind the scenes, and to grow infinitely. So that's really what got me involved. And on the heels of that, a gentleman, a senator from Vermont decided to run for president, Bernie Sanders. And I thought, here's somebody that has the right vision, was talking about Medicare for all. So I jumped on his campaign. I worked for him, traveled the country with him in 2016, ended up going to the convention with him. So that was a phenomenal experience, and really that's where I met a lot of you and met people all over the country who are really fighting for this. I feel like I'm coming in at the intermission here almost in the Medicare for all movement, because now is our time to build. Like, this is the time when we have to pull ourselves together. We have to really create some solidarity, because we have the vision. Right now, we're hearing about how Democrats don't have a solid plan for the future. This is the plan for the future of the country, right? So I understand why people feel that way, but we have to start leading with our values in this country. And I think this is a key issue where the majority of Americans believe that healthcare should be and is a human right, especially in the richest country in the world. Do you guys see the chart when you came in that they put up? And I like your chart. Healthcare costs in every other country across the world are twice as much as we pay for healthcare in this country because of greed and going towards the top 1% of this country who are making money off of our misery. So again, I'm just happy to be here, happy to carry on this legacy. I am not an expert. Here's your experts up here on healthcare for all. I can talk to the bill that we've reintroduced. Pretty much, we just took it, we looked at it, we made a few tweaks, and we had LSC make a few little changes, and we reintroduced what Skindle has, Representative Senator Skindle has championed for the last 12 General Assemblies. But one of the points I want to leave you with, and I'll turn it over, is one of these arguments that does work pretty well, to Mike's point, is that this is not a radical idea. In fact, if we just go back 10 or 15 years and we were to adopt that tax system that the state of Ohio had, we could find the money in our budget to pay for exactly what we want to do. A universal health care plan that would be like any other around the world, maybe even better. Because in America, we can do it better, I think, if we were able to actually do it and basically expand Medicare and run it as a state public option for folks. So we wouldn't have to increase taxes on anybody earning less than $200,000 a year. We'd actually save companies money because they're paying out the nose for their health care plans. If we were to actually universalize it, we can spread those costs out, like Mike said, and it would actually not be a burden, and it's not a radical idea by any means. So again, thank you all for being here. Thank you for having me, and happy to come and talk about this.
Thank you, Tristen. Thank you, Mike. Well, a lot of times the pushback is, well, this is going to take away. It's going to take away my benefits. It's going to take away from my VA benefits, my union benefits. Is that how the bill will work?
Maybe I can answer this more fully, and I'll do a politician thing and I answer your question. But I will talk about something that does worry me, and people do talk to me about. Like, the people will come to me and say, I'm in medical billing. I don't want you taking my job. You're going to get rid of my job if you do this, right? So I understand that. That makes a lot of sense. That's an honest question coming from an honest place. And this bill actually provides a 2-year period where it'll pay somebody who's in the healthcare industry or in the health insurance industry, any industry that's going to be displaced by the $60,000 a year to retrain, to have the jobs that these program is going to create. So it is going to be a transition. It's going to be a little bit hard, a little bit scary, a little bit uncomfortable for some folks, but it has to happen. Too many people are suffering. So that I want to address that. Maybe Mike, you can address the fuller question.
Does it take away from your health care? So what it does do, it won't impact the VA system because that's a special system. But what the plan does do is it calls upon the state to seek a waiver with the federal government with regard to Medicare dollars and Medicaid dollars, to bring it into the system to help fund the system. In addition to those dollars, it would be then supplemented with a progressive tax system, which primarily falls upon the wealthy. Understand that corporations and the very wealthy pay very little taxes here in Ohio. Many folks in this room probably pay more taxes, Ohio taxes, than some of the largest corporations do.
That's right.
So, so the VA system would stay in place if those. And right now there is a bill that is being or has been reintroduced in the U.S. Congress to allow these states to do this very same thing by setting up a healthcare system, a publicly funded healthcare system, and then draw down those Medicaid and Medicare dollars into that system to cover everybody in that state. And that bill has been introduced a couple of sessions. It's a concept that Bernie Sanders actually raised during the Affordable Health Care Act to allow states to develop their own publicly funded system. You get to choose your own doctor under the SPAN single payer plan. You get to choose your own hospital. Doctors and hospitals are not socialized like in England. And what do we talk about socialization there? There in England, the doctors are employed by the state, by the government. The hospitals are built and constructed by the government. Here, under the single payer plan, somewhat like Canada, you have independently run doctors, independent doctors, and independently run clinics and health centers here in the U.S. All we're talking about under the single payer plan that we have introduced is how do we pay for the system, just like Medicare. Under Medicare, depending upon what plan, you can choose your own doctors, things like that. You choose the plan, you end up choosing the doctors within that plan. So you can keep your doctors if you wish under this plan, and it's a very healthy system. So people will not be losing their health care. But what we do is those folks that have no coverage at all, and that number is growing, and it will continue to grow under the most recent radical budget bill passed by the Congress just a week or two ago. The numbers of uninsured will continue to grow. It will cover everybody here in the state of Ohio, and it will be something that will attract people into Ohio. It covers residents of Ohio, and it will be something, if Ohio adopts, will attract new people.
Good for business then.
Yes.
Yeah.
So how do we pay for this?
So I think I mentioned it earlier. It's an increased income tax for folks that make more than $200,000, but really it's on the employers. I think it's a 3.6% tax on employers, on the employer side of the income equation. And then there's also a gross tax, which I think is like 0.5%. So there's not a lot. So they kind of cobble together by closing up some of these loopholes. And I looked at it and I'm like, actually, if you flip back 10 or 15 years, it looks similar to how our tax system was when you were in the legislature, even like 10 or 15 years ago. So we've cut taxes for the rich so far in the state of the country that it really wouldn't be a drastic change if you were to look at how we did things a few years ago. And we could easily find the funds to do this. I think also it takes into account the inputs from Medicaid. So those folks would be covered. At the end of the day, it would be a totally, it's like, it's not super different than Medicare for all, where you're just covering folks from 18 to 64. It'll work similarly to Medicare, where folks can pick their doctors and everything else. And it really wouldn't create a lot of burden. In fact, I think in the past, we have seen the business community support things like this, because it would actually mean a lot for their workers, and it would mean a reduced cost over the long haul.
So I wanted to ask, and this is something that I was looking over. So, when you hear the term universal healthcare, a lot of people, it becomes scary. And I have seen, because administrations at the federal level have made it look scary, because it's what benefits them and their donors and the 1% of America. But a poll from Gallup poll actually said that 64 to 75% of Americans are willing to go universal healthcare. So where do you think it's the scary part, or at least why do you think at the political level, people are not getting into it and voting it in when it's what the people want, but the elected officials are not going into it?
Plain and simple, a very well-financed advertising and campaign funded by the insurance companies, the private-run insurers throughout the U.S. don't want this system. They want to continue to rape the system to make huge profits and have executives continue to get paid $40, $50, $60 million a year in salaries. It's obscene. And one way you finance the system is by getting rid of those for-profit insurers, because you then reduce administrative costs by up to a third. And you have cost savings within the system alone up to a third. One other financing component, Tristen talked about the payroll tax and the gross receipts tax, primarily paid by the employer. There is a tax on income, but it's only on the income up and above that level for Social Security. Once you reach a certain level, and it increases every year, you don't pay any Social Security taxes. So this would be taxed on that income, on those people, on that income that's not paying into Social Security. So it's a progressive tax system.
And so with that, what is something that we, at the local level, people can do to work with the state representatives or even the federal government to make this happen and make it happen sooner?
I think one, let's change the language. Instead of I've been using it, universal health care, use healthcare for all, Medicare for all. Let's change the language. The other thing is communicate with your elected representatives, whether at a city council level, state level, like Tristen, your state senators, and also in Congress. If you see somebody, one of your representatives in the grocery store, at church, at bingo, stop them and say, support Medicare for all, healthcare for all. We need it here in this state and throughout the nation.
Yeah, do whatever Cathe tells you to do. That's a good start. Yeah, good work. No, I mean, give yourselves a pat on the back. I mean, being here today and supporting things like this, supporting our doctors who are trying to unionize and really elevate their voice, right? Elevate the voice of people that are in the system. And a lot of doctors support healthcare for all, even though they know they'll take a small pay cut or a pay cut in some cases because they understand how broken the system is. So just keep organizing, keep coming to this stuff. Open up your wallets, open up your hearts, open up your minds, talk to your friends, show up. When there's a hearing on this, if we get a hearing, we'll work through Cathe to make sure that we show up. Showing up is all of the game right now.
Yeah. So what is next for HB
289?
289? What is next for HB 289? And who's going to be on the bus that I rent to drive down to Columbus for the hearing?
Yeah, so I have to mention Michelle Grimm. She's was in our leadership here until recently, but she's also a state rep, really good state rep from Toledo, progressive, who carried this with Mike, I think, last time around and is on the bill this time around with me. I just want to make sure I flag that because she's also a champion.
Yeah,
If you have additional champions in the state, so what we're going to do is get together and kind of lobby the chairwoman of the health committee, who I'm working with on a couple different bills to see if we can't get this hearing scheduled sooner. We're guaranteed one hearing. It's called sponsorship hearing, where me and Michelle get to go give the case. But I think we should show up to that hearing, and we'll also advocate that we get a second hearing, and we'll see what happens with that. I'm not super optimistic because they do have a pretty tight stranglehold on the legislature right now, but at least we'll get that one hearing, and we'll certainly let you know when that happens, and we'll let you know when they decide to schedule it. That's not in our control, but we'll advocate.
Absolutely, we will be a show of force for you, absolutely. And so that means that, sponsors, Tristen, Rader, Michelle Grimm will be able to speak about the bill to the insurance committee, which is where the bill is pending.
Oh, probably, yeah.
And of course, that insurance committee is run by people who own insurance companies. I'm not terribly interested in what
I'm not
anybody
on it.
else
They
is
wouldn't put
saying.
me on it.
And if I understand correctly, historically, the one time that we had a sponsor, you guys did the sponsorship, and then there's the proponent testimony.
Yes, right.
That's when the citizens speak.
Right.
One time that happened, the committee was punished.
No, they weren't punished. The chairman had been around for many years, and they weren't really punished. The problem is the next session they changed committee leadership, and the new leadership of the insurance committee just refused to bring it forward.
Is that Brian Lampert?
No, it was.
Isn't that the current chair, Lampert?
Might be, but it was. I'm trying to think of his.
He owns an insurance company.
So,
Health.
showing up, communicating with our representatives, lucky for me, that's you. I don't ever have
Lucky
to
or unlucky.
message Tristan. Okay, so folks, we have time for questions.
Sure.
There's index cards on the table if you have questions, or I
Just raise your
saw a
hand,
hand
maybe.
go up, so let's
Want that hand to go up?
I saw a hand go up. No?
Thank you. Thank you for this presentation and for advocating for this. I want to know what you all are going to do differently than you didn't in the last 22 years. How is this going to be different or better? What strategy is going to change to help facilitate those changes?
I can answer that if you want.
Let me just respond. We tried over 22 years, different strategies. But let me tell you what's important. It's important for states around the U.S. to introduce these bills in their legislatures, even if they don't go anything, even if they're blocked by the insurance industry. The reason why it sends a grassroots movement across the nation. And because of that, you have legislators in Congress now introducing a bill to allow states to set up these programs. So it does make an impact, even though you don't get it passed. So I introduced legislation here in Ohio with regard to microbeads in the Great Lakes. I knew I was not going to get it passed here in Ohio, but guess what? We got these bills introduced all around the Great Lakes. The federal government finally moved on and passed a ban on the production of these microbeads that were getting into the lake system. So these strategies work, and there's stuff that you can do every session to improve upon it.
Yeah, great answer. I think to kind of build on that, this bill was introduced alongside, I think, 15 other states' legislation around the. I think this is the first time we actually coordinated this many states at once to drop the bill. And there's a press conference in DC with ROCON. My co-sponsor went, my joint sponsor, Michelle Graham, and stood with him. If we can get this federal legislation moving, and then next time too, we have the next Democratic National Convention. It's super important that this is a top level issue in the Democratic Party, right? Because we're not that far. I mean, the Republicans would have you believe we're like this total, pushover. No, we have the majority in this country. We just need to show up. So if we can keep this issue at the top of the list, then we can continue to push and build on the success that we've had over the last few years. But it's going to be on you pushing me to keep this pressure up. So I just want to flag that. But it's built. What's been built, we've been building up for the last 22 years, even though we feel like we're in a little bit of a valley right now.
Anybody else? Any other questions?
You got it? Okay. I'm gonna fall off the stool.
Does that make sense?
Yes.
Okay.
Thank you. Following up on our earlier speaker, the doctor who said she's kind of under stranglehold. Oh, thank you. I'm asking on your behalf, so maybe you want to chime in too. How will changing to a single payer system liberate doctors from the hospital network?
Have her answer.
Yeah. Give the mic to Dr. Bean.
Dr. Bean, what do you think?
I don't know if I can answer that to the
Sure.
level at which, I would need to here, but I will say that, as a doctor, I can't imagine ever not providing care to a patient. The idea of a sick person coming to you and then saying, I'm sorry, you don't have money, to me is absolutely immoral and horrifying and just not gonna happen. And I know that everybody I know who is a physician feels the same way. So not having to worry about whether or not our patients can afford care just to me that in itself is liberating. I'm not sure that's exactly what you were asking, but I just can't imagine, saying no ever.
Do you find it helpful?
Oh, for sure.
I couldn't think of a better answer than that. But I'll add too, we're talking about reintroducing a bill that Jeff Crossman introduced a while back that would codify the ACA into state law. So at least we have some pre-existing conditions, protections in state law, right? So we met with some doctors at a hospital here. I don't know if they want to be public or anything about it, but because what they told me was they spend an inordinate amount of time dealing with the insurance industry, an inordinate amount of time submitting things, then getting them back, putting patients on medication they don't want to put their patients on because the insurance industry is dictating to them how to treat their patients, even though they know better because they're their doctor. So I think having a system that is much more straightforward. I know that doctors have an easier time dealing with Medicaid and Medicare than they do with some of these insurance companies. So, yeah.
I think the statistic is that it's like something on the average of $80,000 per year per provider in the state of Ohio, just to pay somebody to chase the insurance bills and actually get
crazy.
paid.
I just wanted to add that there's this whole thing with pre-authorization.
Okay, so
And I can remember one
That's what I'm
patient
talking about.
specifically who I was afraid she was going to tank on me in my office.
that's a
And
doctor.
there was another doctor who agreed with me right there that she needed to go in. But the insurance company wouldn't authorize the payment, the admission, and the patient wouldn't go into the hospital unless the insurance company said that they would would pay for it. And not having to deal with this whole pre-authorization garbage.
That's right. That's what I meant.
From somebody who doesn't know medicine.
That's right.
It just would be a wonderful thing for doctors and patients alike.
Well said.
Absolutely. Hand back there.
There's so many ways that single payer would change the landscape of people's lives. I mean, I think about all the people in jobs that they don't like, but they stay there because they have to have that health insurance. And for employers, back to the argument for people on the other side of the aisle, it's brilliant for employers because they have people working for them who choose to work for them, not who are just not maybe into the work, right, but there because they have to have insurance. But Michael, I'm wondering if you're willing to share the story of your aunt, because I think that is very, it absolutely gets to the heart of what is so deeply wrong about the system we currently are saddled with.
Thank you, April. So my mom's sister, there's a history of breast cancer on my mom's side of the family. My aunt was 57 years old and was diagnosed with a very aggressive form of breast cancer. She was working through the initial treatment. Things were declining, and she was struggling because she could barely get to work. And this is a period that maybe it was about 9 months before she passed away. But she couldn't do it because of this delay to get onto Medicare, the 2-year delay. To be without health insurance was just impossible. She ended up not being able to work anymore and stopped. And it just drained the family because my uncle's insurance would not cover her. His employer's insurance would not cover her, and she could not get onto Medicare. And the unfortunate, more bills weren't racked up because of her unfortunate passing. You have situations like that all the time that people are struggling, and some unfortunately will bring an early end to their life so that they don't have a burden on their family's life. I do want to say the doctors out there are wonderful, and I know the process of asking the patient for payment is difficult. And we know this whole situation with the Cleveland Clinic this year saying that, hey, you're not going to get medical treatment if you don't pay your deductible copay up front. Now, they said because of public outcry and a lawsuit against them for that, they dropped that, so to speak. But I do know of a nurse friend who went into the Cleveland Clinic last week because they had a stroke, were partially paralyzed in the emergency room, and the payment person came by and saying, "Can we have your copay right now?" Yeah, in the emergency room.
And I
Yes.
was there with this with you too, because I have
Yeah.
a similar experience. I have a
Yeah.
5-month-old, and
Yeah.
when he needed his 4-month-old vaccinations, the county person decided that they would. In the United States, it's a legality to give 0 to 18, I believe now it's 24, healthcare.
Yeah.
And my son was declined for some reason. So by the time my job would get his insurance put together, we figured out the county made a mistake. The person was declining a bunch of people right away and not paying attention. The Cleveland Clinic said we will not, take care of your 5-month-old to get his vaccinations because you need to pay $17,000 on the spot, or it's nothing. No down payment, nothing. Plus, pay $17,000.
Or you don't get.
And someone like me works for local government. I don't have $17 laying in my house. I wish I could. So it is hard. And by the time that my job would get all that paperwork put together, it would have been like probably a month and a half. So it's definitely it's a need. And I know it's here everybody most likely agrees with us. It's like preaching to the choir. But for those that are online watching and knowing, these stories are what really brings out the situation and really tells people you need to put universal health care out there. You need to put the health care for all out there and make sure that people are taken care of, because our country, that's one thing that we need. We're not healthy and we need health insurance. We need a way to survive, and hospitals and doctors are the way to keep us alive, right? So, yeah, I just wanted to share that too.
Yeah. Questions?
Questions?
Any other questions?
I've got a quick thing that I'd just like to play for everybody. You know, we've been talking about these insurance issues. And I don't know if anybody's heard of United Health. A lot of people have United Health. They own a lot of practices, they own a lot of hospital systems, they're getting into everything. They're not just an insurance company. Right. So there's this young man named Jesse Wells. Anybody heard of Jesse Wells? There we go. So Jesse Wells is sort of today's Woody Guthrie, in my opinion. I'm just going to play this a minute and 41 seconds. It's about United Health.
Oh, I know this guy. I heard this one. It's actually good.
Uh-oh. Hang on. Gotta get it turned up enough so that it'll.
Salary to deny what you're owed. There ain't no you in United Health. There ain't no me in the company. There ain't no us in the private trust. There's hardly humans in humanity. The procedure that you need ain't the cost-effective route, and only 2% of people end up winning a dispute. So if you get sick, pray to God for help, cause all your doctor's prayers go up through United Health. Way back in 77, Mr. Richard T. Burke started buying HMOs and putting federal grants to work. Now it's $50 million he made just last year. The Warren Buffett of health, but Jeff Bezos appeared. CEOs come and go, and one just went the ingredient. You gotta make the cake you get. So if you get sick, cross your fingers for luck, cause old Richard T. Burke ain't giving a fuck. Woo! The modernized health, monopolized fraud, there's doctors that we own and research that we buy. The loans and physicians, pharmacies and meds, they should start selling grades just to fuck you when you're dead. There ain't no you in United Health, there ain't no me in the company, there ain't no us in the private trust. There's hardly humans in humanity.
Well, on that note, I think it's dinner time.
Yeah.
Food is ready.
So to close, I wanted to ask you, gentlemen, how can people stay in contact with you both and also find out about this bill more without, sending you 1,000 emails in a day?
Oh. Anybody answer that? So again, I do what other Cathe said. You guys are well organized, right? And I think you need to stay organized as a group. People right now are looking for things to do that make a difference. I can't imagine something that would make a bigger difference than actually universalizing our healthcare system. So please stay in touch with her. TristenRader.com if you want to connect with me, join my mailing list. I keep people up to date what's going on in the legislature. Follow me on social media. One thing that we are doing a little different, I'm on social media all the time, trying to put out what's happening. So anyway, follow us and we'll connect with Cathe, and that's about it, I think.
Michael, are you on social media?
I'm on social media.
How can we find you?
Mike Skindle on Facebook. So that's the best way to do it.
Right.
Yeah.
And thank you for everybody. If you want to watch the live stream, you can search Politico, like the magazine, but it's not the magazine. It is my podcast, and that's where I will be live streaming this too. And you can also listen to many more episodes about healthcare on that podcast too. And make sure to celebrate 60 years of healthcare for all Ohioans. And if you got your phone, right there on your tables, there is a QR code. So if you donate $5 today, that little thermometer, we're trying to get it all the way to the top. It will turn blue, which means like blue is good in the colors. So send that QR code, donate $5. Let's see if we can get to $5,000 by the end of the night. And if we can, we'll celebrate with a birthday cake. But if we can't, I'm taking the cake home. So
Thank you, guys. Thank you.
Thank you to Mike Skindell and Tristen Rader, everybody.
Thank you. Thanks, Cathe. Well done. Thank you. Yeah, Mike.
All right, the food is on the table.
Did you get some good pictures? Did you get a picture? I want to get a picture.
Hey, do you remember who you are?
Oh, yeah, I forgot already.
We send them to you.
Yeah, I would love to get a few so I can post them. Oh.
Yeah, okay. Scan those QR codes, make more donations. Come check out our raffle. We have beautiful